Welcome to the Now What podcast, a podcast focused on young adults, epilepsy, and the problems they face. I'm Sophie, your host and an advisor to the Cameron Boys Foundation. TCBF honors the legacy of our best friend Cameron by aiming to cure epilepsy through funding research, education, and awareness campaigns while still supporting causes that were important to Cameron. In this episode, we'll be covering mental health and epilepsy. If you're a regular listener, you know I'm usually with my partner in crime, Karin Brar. However, Karin couldn't make it today, so I will be joined by Ben Teller, our digital director and podcast producer. Ben's also a cancer survivor and has close experience with illness and mental health. We are incredibly excited about the conversations we are having each week, and it wouldn't be possible without our sponsor, UCB, so thank you, UCB. Now, our guests for the week are Dr. Rizakos and Mia Randall. Dr. Rizakos is a licensed psychologist who specializes in treating children, adolescents, and young adults with a variety of emotional and medical conditions, including epilepsy and other functional neurological disorders. Dr. Rizakos' resume includes a faculty position at Children's National Hospital in DC in the Neuroscience and Behavioral Medicine Division with a specialized focus in the Comprehensive Pediatric Epilepsy Program. Mia is an epilepsy advocate and sits on our Young Adult Advisory Committee. She's been on a few episodes, so you may know her by now. I'm very excited about this episode. It's so great to hear about Mia's experiences as a young adult with mental health and epilepsy, and also hear from Dr. Rizakos on ways that we can manage mental health and chronic illness. It was just very affirming for me to hear as someone who's also gone through my own issues, so I hope you guys take away something from this. Thanks so much. Get right into it. Hello, everyone. Thank you guys so much for being here. I appreciate it. I'm very excited for this episode. To kind of just jump in, Dr. Rizakos, can we just get can you describe like the most common mental health challenges for young adults living with epilepsy, whether that's, depression, anxiety, ADHD? What do you see most commonly?
Yeah, so I think those are the areas that really are most common. I mean, generally speaking, we know that young adults with epilepsy are at heightened risk of developing mental health challenges. Certainly anxiety, depression, and ADHD are amongst the most common. And I think I can describe them a little bit more too, because I think sometimes when we think about depression, really like that sadness pops up in the mind of that means I need to be feeling really sad. But sometimes sadness can be there, but it doesn't have to be. Sometimes it's more like a loss of pleasure or hopelessness or helplessness. And it can also, I think sometimes people think, well, if I'm depressed, maybe I'm isolating, or it means I'm not hitting the activities like work or social that I should be doing. But really, sometimes you're engaging in those, but you're just not feeling that joy that you used to feel when you were doing them. And then I think too, right, it can be an increase in sleep, but also it could look like a decrease in sleep. And same thing goes for appetite. It could be that increase, but it could also be a decrease. So it really varies within I think that depression diagnosis. And then similarly with anxiety, I think we think a lot about, frequent fear or worry, and then that keeping us from doing the things that we want to be doing and causing us to avoid activities. But also with anxiety, it can occur really like physiologically. Like sometimes it's not, you don't have someone saying they feel a lot of worry. Sometimes like the first thing I have someone saying to me is that they have a lot of headaches or they have a lot of stomach. So sometimes like that primary presenting issue isn't with emotions necessarily, but it's with like those physical symptoms. And actually similarly, that can go for depression as well, where someone could feel maybe just like a lot of fatigue and tiredness.
That makes a lot of sense to me. It's interesting. I always think the connection between mind, body, and especially when we're talking about chronic illness can be super interesting. Mia, if you're willing to sort of speak to some of your experiences with this, I'd love to just hear a little bit about what you've kind of gone through in general, any diagnosis or just issues that you've felt like you've dealt with.
Yeah, definitely. So I have anxiety and depression, and I didn't have those before I had epilepsy. So there's definitely a correlation there. Particularly the depression came on very strong, especially through my stage. It took 10 years for them to diagnose my epilepsy. And I think that was probably when I struggled the most with my depression. I mean, that also kind of coincided when I was in puberty and adolescence. And there's also a lot of factors there, I'm sure. But when you're going through trying to find a diagnosis, there's a lot of those feelings of hopelessness and helplessness that Dr. Rizakos was talking about. And like the depression really like latches onto that. And so I was feeling so helpless and hopeless and isolated. And so being able to get that diagnosis definitely helped that. And then finding a community also definitely helped that. But still, there are those moments when having epilepsy, especially because this diagnosis still comes with so many questions. Epilepsy is just kind of an umbrella of just more questions. It's just a lot of, oh, we don't know, we can't really help. It's just more tests and more questions and not many answers with epilepsy. So despite having the diagnosis, there's still so many things left unanswered. And so there's still that kind of sense of helplessness and feeling lost and just wandering, feeling no end in sight, especially with no cure for epilepsy. So I feel like the depression really can latch onto those feelings. I'm sure the people with epilepsy can relate to that, just feeling like, especially in moments when your epilepsy is really strong, or maybe if you had a big seizure and you're just feeling like, how am I going to do this my whole life? There's no cure. Or if you have drug-resistant epilepsy, you're like, am I ever going to find something to help this? And so I found stuff that does help is getting with the community and people who do understand, because it is very isolating, and finding people who you can talk to that about, even just the people who have chronic illnesses, who get that feeling of like, this is something I have to bear my whole life, and you can talk about that with them, and it helps that like isolating feeling.
Thank you very much for sharing. That's great to know and get a little bit of your background. And also thanks for just being open. I think mental health conversations can be very difficult. As far as when Dr. Rizakos, when you're meeting with new patients who have been sort of recently diagnosed with a chronic illness, how do you feel like you go about those appointments any differently? Like, how do you sort of handle that that big looming thing? Because there isn't always a cure. There isn't always like going to be an answer for them, which I think can be really difficult. I can't imagine.
Mm-hmm. And I primarily work with individuals with chronic medical diagnoses, and even more so with epilepsy. And you're talking about the mind-body connection, and that's like really what brought me to working in this area, because I felt like if I'm going to be talking about mental health, the mind and the body are connected. They're not separate. I want a place that also encourages talking, not just about the emotions, but also the body. And then so that led me to medical diagnoses, because I felt like, okay, we're talking about mental health, but I can't ignore the physical or the medical that's taking place too. So that's really what brought me into this area and really loving this area of work. I think in terms of assessing the emotional part, it's similar, except, and I think this is important if you're going to work with a mental health provider, that they have that specialty if you're able to find someone, because then you don't feel like you're teaching them about your experiences, right? Everybody's experiences are personal to them, but Mia talking about like it feeling isolating and all the medical appointments and all the questions and all the unknowns. If I have that specialty, I already know that those are possibilities of challenges that the person is going through. So it's already on my radar. There's lots of different types of therapy. When we talk about therapy, I'm talking specifically about talk therapy. So there's different types. And so I think there's some types that actually support individuals with chronic medical diagnoses a little bit more, because sometimes, cognitive behavioral therapy is sort of that, you hear that a lot, CBT a lot. It's sort of that gold standard therapy because it has a lot of research behind it showing its efficacy. I do think it works really well. And sometimes though, I want to pull in other types of therapies because I think they really hit home specifically like for individuals with epilepsy. For example, CBT sometimes can do a lot of like challenging your thoughts or your feelings. And sometimes, or oftentimes, if I have someone in front of me saying, I feel really sad or I feel really scared about my seizures or my epilepsy, I'm not going to challenge that, right? Like that is really normal. And so there's other types of therapies that I'll pull in, like acceptance and commitment therapy, which actually says, hey, like experiencing negative emotions is a normal part of the human experience. And actually, when we judge ourselves for having negative emotions, that's when challenges can come up for us sometimes. So I really love it because it uses language to help us accept our emotions rather than judge ourselves for our emotions. And similarly, dialectical behavioral therapy, or DBT, is really lovely too, because it can tap into dialectical, meaning like two opposing ideas can exist at the same time. And so I find this to be really lovely for my patients with chronic medical diagnoses, because, for example, you can say something like, I am fearful that I'm going to die, or I am fearful that I'm going to have a seizure, and I can have a good day today, right? Like those two things feel so opposite, but that it helps support that idea that both of those two things can exist at the same time. So that's really what I think I tend to lean more into. CBT is definitely good as well for certain areas, but I think when working with individuals with epilepsy or chronic medical diagnoses, I find myself really tapping into those strategies that validate those experiences that Mia was talking about.
When I was in high school, I did quite a few years of DBT. I did it with a few different therapists, and I also did group DBT therapy, which I was initially very against, probably because I was like a very insecure high schooler. And also when I was in high school, mental health still had quite a big stigma around it. And like the word depressed and depression was very much not a common word to speak. And if you said it, it was very like, you're depressed, like what? And so that was a whole isolating thing on its own. And so having that group therapy and getting to be with other kids who were also going through it, maybe they didn't have chronic illnesses, but they were also going through depression, was just a whole nother sense of community. Like you're just finding another community of people who you could relate to and learn from and have bonds with. And so I ended up finding group DBT therapy to be incredibly helpful. I had it in supplement to my normal one-on-one DBT therapy, because group, you can't get out all the things you need to get out. So I think it's a good supplement. And I know now mental health has a lot less stigma around it, but I can imagine it can still be isolating because everyone kind of throws around the word depression and they're like, oh, I failed my test, I'm so depressed. And if you actually feel like you're going through depression, that can make you feel probably frustrated and being like, okay, well, like you're not really depressed the way I'm depressed, and that can feel isolating in its own way. So finding a group of people who maybe feel the same way you do can be helpful. And I tried CBT and I found DBT to be a bit more helpful for me, because I was struggling through things like I was an incredibly like straight A, super smart, top of my class student. And then when I got epilepsy, all my grades fell and I didn't feel smart anymore. And like Dr. Rizakos said, like I was able to kind of accept, even though my grades are poor, that doesn't mean I'm not smart anymore. Like it's just, there are other factors affecting that. I haven't lost my intelligence. It's just something is out of my control and it's making these grades fall, and it's not a reflection of my intelligence. And so like I found DBT more helpful, but to each their own. It's just my experience.
Yeah, it's definitely good to be able to tailor, to have a provider who maybe has like a couple or a few different types of therapies in their toolbox, so that they can tailor it to what you need, right? Like you're saying, Mia, depending on what your strengths are or the areas that are harder for you. And also what I think is important to mention is that, there's all this research about what type of therapy is the best and what's going to be most effective. And there are certainly therapies that are most effective depending on the challenges, but also what's really important too, and some argue most important, is that goodness of fit, they call, which is like how well you get along with your mental health provider, right? Your psychologist or your therapist. And that actually tends to be the main indicator of whether or not therapy is going to be effective for you. So like these strategies are really important, but also finding like that best fit. I always say like your medical provider, you want to be able to get along with them, but it's not the most important. You want to feel like you trust them, that they're smart, that they know what they're talking about. But for your psychologist or your therapist, you want to be able to share like your deepest, darkest, right? And maybe you won't feel comfortable right away, but you want to feel like there's potential to get there. And so that fit part is really important too.
A tip, because I changed therapists, I think 2 or 3 times. And I found a good way to tell was when I caught myself like holding back from telling my therapist things, or even kind of like telling white lies to like make the story seem better or less like not in my head, like intimidating or like intense. And so when I found myself, like doing those things and hiding these things with my therapist, I was like, okay, well, maybe I don't trust them. all the way. Like, and my therapist, or not my therapist, my parents could kind of tell that things weren't going well with the therapist because it wasn't making improvements. And so then we thought about finding a new one. And it's like, it can be daunting to be like, oh, I have to start over. I have to tell a new therapist like everything again. But you're not going to move forward at all and make any progress if you're with someone you don't trust. So like doing that initial bit of like work of starting over with someone is worth it in the end if you're going to end up making progress.
Yeah, Dr. Rizakos, do you have advice on how to maybe, if someone's calling you to reach out and get care, like what questions they could ask to identify if this is a right fit, or if you've never been in therapy before, how would someone even go about that process, knowing if this could potentially work down the road?
Yeah, that's a great question. I think, there's definitely questions to be on your radar. I think first, right, outside of the sort of rapport and the connection, which I think that really happens, I say like assess that in your first few visits. Like Mia was saying, I'm like so happy, Mia, that you tried out different therapists, because I think a lot of people feel hesitant to do that because it's not necessarily something that you feel like you're able to do or that's appropriate to do. And as psychologists, I had training that said like fit is important. So make sure that you make it, you let your patient know that, and you make sure that they know too that it's okay if this doesn't feel like a good fit. It doesn't necessarily mean that either of us are doing anything wrong, but that's a really important role for therapy to be effective. So that I think comes with time, but in terms of questions of figuring out, are they equipped to best serve me? I think making sure that they are trained with your age, right, and population. If they only work with children and you're a young adult, right, they're not going to be aware of the different types of stressors that are coming up in your day-to-day. As well as I think at the very least, right, if you're struggling with anxiety or depression, you want to make sure that that's a specialty of theirs as well, right? So making sure that they have a specialty in your age and your population. And then as we become more and more specific, it's kind of hard. It can get harder and harder, right, to find that therapist or that psychologist who you're looking for to be a great fit. If they have experience working with individuals with chronic medical conditions, fantastic, right? And then even better if they have that experience working with individuals with epilepsy. But we know that's not so easy to find. I think the good news is there are lots of different things that have happened to try to increase access to the providers, the mental health providers that you need. For example, virtual is now a big thing. It became a big thing during COVID when we couldn't go to in-person visits anymore, and that's helped increase access. And then also from a psychologist standpoint, it used to be that I needed a specific license for every state I was going to practice in. But now there's been a new type of license called PsyPACT, PSYPACT, that if you have that type of license, any participating state allows you to practice virtually with individuals in that state. And right now, I just looked it up yesterday to make sure I was up to date because it's constantly changing. Right now, there's 42 states who participate in PsyPACT. So that like really opens up the door for you to be able to find that tailored psychologist who has experience working with your challenges, because you don't necessarily, if you feel comfortable to do virtual therapy, then you can look outside of your state as long as they have a PsyPACT license.
That's fantastic. Yeah, I also think, especially when we're talking about epilepsy and how many people living with epilepsy can't drive, the virtual, I can only imagine how much that increases accessibility. And I hope people are encouraged to reach out. I've done virtual therapy. I think it's great. Sometimes there's something about being in the comfort of your own home too that can like kind of relax you into the therapy session. We're like talking with a friend. As far as I don't think I kind of blew past this question, or I'm backtracking a little bit, but is there an increased risk of suicide in those living with epilepsy typically?
Yeah, thanks for mentioning suicide, because I think that's an important part when we're talking about mental health. I think also important, whenever I talk about suicide, I always let listeners know that like if you're not feeling equipped to listen to this information at this point, to just sort of, shut off this part and kind of, fast forward a little bit, because sometimes we're not in the space to hear this information. I think before pausing, if you feel like you're not equipped to hear about suicide at this moment, the very least I think important to know is that 988 is that crisis number for you to call if you or someone you love is experiencing a mental health crisis. And that number, the development of that number was so important because it used to be that we would call 911 and they're equipped for, medical crises, but not necessarily mental health. And with this 988 number, you get a trained mental health crisis counselor on the phone. And so I always say, like, if that's all you take away from this part, like, that's the most important. And, you can fast forward. But to give a little bit more detail, I think that since individuals with epilepsy are at heightened risk of experiencing depression, they are also at heightened risk for experiencing suicidal ideation or experiencing suicide. And in the general population, that number is high. Suicide is in the sort of 10 to 24-year-old age range, it's the second leading cause of death, right? It's above cancer. And so it's something that is common and happens in the general population. And then with the epilepsy population, right, we know that they're at heightened risk for experiencing it.
Yeah, I appreciate you mentioning 988. And I do think, it's a very incredibly hard thing to talk about, especially suicidal ideations or something that can arise and be triggered by many different things for people. But I also do think it's important that we mention it. So, because like Mia said, so much is about realizing that your experiences, as isolating an individual as they are with epilepsy, you're not alone.
And just to maybe put in my 2 cents to it as someone with epilepsy and someone who has very deeply experienced those, for most of my time with my epilepsy journey, I have struggled with suicidal ideations and thoughts and all of that. And I would say, looking and introspectively looking at it, I think when they're strongest is probably when I'm experiencing epilepsy burnout. And I just feel like in that state of I'm doing all these things, I'm trying all these medications, I'm getting all these tests done, I'm going to all these doctors, and nothing's happening. I'm still having seizures, or I'm not getting answers, or nothing's helping, or the medication side effects are still affecting me. And I'm sure a lot of people who have epilepsy know what I'm talking about and have experienced this burnout, or just this sense of wait, and I cannot do this anymore. I cannot keep moving forward with my life when I'm not actually moving forward. And it's just everything's pressing down on you. And you're how am I going to keep doing this? How am I going to keep going? And then you start having those suicidal ideations because you're I don't want to do this. I don't want to, especially when you have friends, or I have 4 siblings who don't have any chronic illnesses. They're very, very healthy. And it's you see all these people who are don't have to have any of these thoughts. They can all drive. They don't have to go to the only doctor appointment they go to is their yearly checkup with their normal physician to get their shots or whatever. And you're getting your blood drawn twice a month, every month, and doing all these types of tests and getting spinal taps and crazy stuff. And you're oh, to live that life of never doing anything. And you're that will never be me. I'll never have that ease. And so just those thoughts weighing on you. And the way that I feel I've been able to pull myself out of that, because it ebbs and flows. I know it will come back, and I know that I'm not going to be at a high forever. That's just how having depression works. But the way I can pull myself out of it is with community. And the Cameron Boys Foundation has been amazing for that. But using my epilepsy as a purpose instead of this weight, I use it as a purpose. And it's okay, let me use this thing that's a burden on me as something good. And I can use it to help other people, or I can use it to raise money. Or even if it's not to help people with epilepsy, I can use it to help people who are struggling with other chronic illnesses, or who are struggling with mental health. Because of my epilepsy, I'm struggling with mental health. And it's you turn it into something that can be positive, and then you start associating positive thoughts with your epilepsy instead of these negative burnout thoughts. And that's kind of always how I've been able to crawl and pull myself out of it, is just turning this weapon that's against you, and turning it into something good and positive light out of you. And I feel It can be hard. It's like not easy, and you're going to cry a lot, and you're going to feel like, I don't want to do this. I don't want to put all this effort into this. I'm already putting all this effort into just trying to survive. But once you start doing it, it will feel like so rewarding and like addictive, and you just won't keep wanting to do it. Like I've done all these podcasts now. It's like my favorite thing when we have a podcast planned, and it definitely helps. And I think it can help other people to find some sort of thing that brings them that joy with their epilepsy, whether it's just maybe teaching one person a day about epilepsy. That's how I started. I just started educating my friends. And then I got seizure first aid certified, which I was really excited about. And I got my friend seizure first aid certified. And it's just like, can be baby steps. You don't have to do something big right away. But like just turning it into something positive can be so helpful for turning those negative thoughts around.
Let me tell you, that was so profound, Mia. Like I mean, doctors, I am like, how you turned that, the way you said it, out of a burden into like a purpose is like, I think is so inspirational for people to listen to, because it's so hard when you struggle with something that you feel so alone in, to take that and like use it to help other people is such an important message for so many people to hear.
And like anyone who's been there, like I've been there, like I know what it's like, and I know it's hard. And like, I know me saying this makes it sound like it was easy for me, or like, I don't know, inspirational speakers can sometimes feel like so far away, and like I could never do that. And I feel like I'm sounding a little bit preachy, but like I have been like down in those trenches so many times in so many different parts of my life. And so like, I get it. And like, you can do it. You can start small, and then you don't even ever have to work your way up. You can stay small, and it can really help you. So I just like, that's my little bit of like wisdom and advice to someone who's like been through that. And even if you fall back into those suicidal ideations, like you haven't like lost, you haven't like, you can get back out of it. I fall back into it all the time. And like, yeah.
Dr. Rizakos, can you talk about maybe like self-compassion and the importance of like that in this process? Because it sounds like it can be like a burden, but then you can like love yourself in that process. How would you say, like, I know it's like part of ACT, but like maybe speak to like some of those kids that maybe just feel alone and like they're the only ones that are kind of going through this?
Yeah, absolutely. Yeah, I want to say, like, I'm so in awe of you, Mia, for just being so upfront and vulnerable about what you have experienced before. I know that is not easy to do. And maybe you're saying, now you're excited and it gets easier and easier. But I think about, what I see in the day-to-day of all my patients, of it's hard to talk about it with even the people who love you, right? Like your family and your friends, and to just go on platforms and to talk about it and to be vulnerable about it. And I think what you have to say is most important in this area, because I can be in visits and I can try to give the strategies and validate. But there is nothing that tops having someone who's going through similar challenges saying, hey, I've been through similar challenges medically, emotionally, and I can get through it, right? Mm-hmm. And I've gotten through it. Like, I think that has the biggest impact. Like, I don't think there's anything I can say to top that, right? So just thank you so much for saying that, because I'm just picturing everybody who that's going to help. And like you said from the beginning, make you feel less isolated and less alone, because it is really isolating, and it does feel very like no one understands, right? And it can feel so scary to join support groups or group therapy and get that validation. So if this is the first place for someone to be like, wow, that validation does feel really amazing, or it has really helped my mood today, or did make me feel less anxious or more hopeful about what my future could feel like. Like, it's just so important what you said just now.
Yeah, I'll agree with that. We always love talking to you, but it's extra special to kind of hear some of these, I don't know, more personal stories, because I do think it is, and it's something we, even within like our own social media and support groups and stuff, we hear all the time, the feeling of like, nobody else knows what this is like, and I don't know how to get through my days and things like that. And it makes a very big difference. I am curious, as far as we're talking about sort of like this community outreach and stuff, for therapy, accessibility is often an issue. Dr. Rizakos, can you speak to some of the challenges for people seeking help? and maybe alternative means and group therapies that you would recommend people seek who can't afford insurance or afford therapy.
Mhm. Yeah. And just really quickly to go back to what Ben was saying, and I think it looped in what Mia was saying, progress, sometimes with that self-compassion piece, right? Self-compassion piece, progress is not linear, right? It's not a straight line. I say that all the time. I think my patients probably are tired of me saying it at a certain point. Like it's not that things get better and better every day, right? Progress is actually filled with ups and downs, right? Often like draw a chart and I'm like, it's not a straight line, right? We're going to go up and down, but we're still heading in the direction of it getting better, right? And so I think in terms of self-compassion and progress, I think that part is so important to not feel like you're going backwards when you have a down day. Not to feel like you're going backwards if you worked through suicidal ideation before and now it's popped up again, right? To normalize that experience and say, okay, this is a part of the progress, right? The ups and the downs. In terms of access and barriers, I mean, it definitely can be really hard. We know that a lot of mental health providers, they have really long wait lists. You can find one who maybe you like, and then they say like, either I'm not accepting new patients or it's going to be about 3 months until potentially I have an opening. And then when you're looking for a provider who is more geared towards your specific challenges, right? Not just, hey, okay, I want them to be familiar with anxiety and depression, but I would love for them to be familiar and have a specialty in working with individuals with chronic medical diagnoses or even epilepsy. I mean, that starts to narrow the pool more and more and more. So I think that access becomes hard, certainly cost. Not going to go on my soapbox about healthcare, right? But like, it's really tough to figure out like, how do I find a provider who is in network for my insurance? And then also there are providers who are out of network. And so sometimes that cost, right, is really, when we're talking about out of network providers, can be really, really tough. And again, though, I think that there are some things that have been implemented like PsyPact, which means you can start looking outside of your state, right? That virtual therapy. I always sit a really long time sometimes with families to talk about insurance and you can always call the mental health number. Sometimes it's called the behavioral health number on the back of your insurance card. And you can ask your insurance to send you a list of in-network mental health providers who are in your area. So that can sometimes, if you're feeling like I need them to be in network, I cannot pay out of pocket, which is understandable. You can go ahead and call your insurance company and try to get them to do a little bit of the legwork for you, right? Because it can be such a long process. And then the other part is I do think that I've had families that have luck with talking with their insurance and seeing if they have out of network benefits, right? And so I think especially when you are individual and you need specialized intervention, right? You're saying like, hey, you sent me a list of mental health providers, but none of them have experience working with individuals with chronic medical conditions. And this is really what I'm looking for. Sometimes you kind of have to like put that fight in a little bit and it can be really time consuming, but I've had families where when they check in about their out-of-network benefits, they can get up to about like 80% covered, right? So that can make a huge dent and make a huge difference. And I always say like the billing codes you want to ask for, right, are like 90834, which is a 45-minute therapy session, and 90837, which is up to 60-minute therapy session. You can ask them, if I found a provider I like, but they're out of network, how much would you cover for this billing code? And you can get that information. So I think like those are a couple pieces that I say sometimes to kind of work around, and then get on as many wait lists as possible, right? If you find a few providers who you like and they say we have a wait list, put your name on a few, and then you can call them back if you find a provider who you like and just get them to take your name off the list. But I think that's definitely a good way to just try to get that care as soon as possible.
I'll also speak super briefly. I think this is one of my, issues with this sort of like finding mental health therapy and stuff. So often the people that are the most depressed just don't have it in them to even do the search. And if you aren't lucky enough to feel like you have the supportive parents and stuff to help you, if you can find it in you to ask a friend to just even help you, sit with you while you search. I've offered to do it for friends before. People do want to help you, and it's not as big of an ask as you think, and it can make a really big difference, because if that's the barrier to you getting care, like bringing just one person in to sort of be your ally in that search can be huge. And hopefully, if you're a young person and you have the support of your family and your parents, that's great too. But friends can also be a source for that. I just want to sort of put that out there.
I think that's a really important point to bring up, especially someone with anxiety. I know other people with anxiety, some like traits of it can be really hard to send an email or make a phone call. Like that can seem, which is to maybe people who don't have anxiety, that can seem like so silly and stupid, but people
I'm laughing at myself, and I do have it.
Get it. Like, I know you get it, Sophie. And so even if like you just ask the friend, like, hey, can you sit with me while I send this email, and just have them hold you accountable? Like, can you sit with me while I make this phone call? Like, I've had friends do that. And like, I would do that for a friend. You're not even really, it feels like maybe you're asking them to really do something, but they don't even have to do anything. They're just holding you accountable, sitting next to you, with you. They can just sit on their phone. You have the TV on, whatever, and hold you accountable to sit there and make that email, make that phone call. And instead of you sitting around waiting days, even weeks, sometimes it takes me to like send the stupid email that I already know in my head, what I would type out, what I would say, right, who I would send it to, and you just can't get yourself to do it. If you have someone there to hold you accountable, then you get it done in 5 minutes opposed to 2 weeks. And so it's like, even small things like that can really help you.
I think it can just make a big difference, because mental health becomes a barrier in itself to getting care for mental health sometimes. And that is I would encourage anyone to try to just bring one person in to sort of help you on that. As far as alternative means, maybe group therapy or resources, do you have anything that you would recommend, maybe that's more cost effective, or that it's just good in general?
Yeah, absolutely. And to your point of like, sometimes it's like the anxiety of reaching out, right, puts a pause or for weeks or months on doing that thing or making that call, or just being able to say like, are you accepting new patients, right? With that said, I also wanted to make sure to mention, with the crisis lifeline with 988, you can also text, right? And so sometimes that idea of like, what's going to happen when like I make that call, right? Or like, how are they going to respond? What am I supposed to say? I think sometimes like texting feels more approachable. It feels a little less scary. So you can also text the crisis text line, 741-741. You can text home there. And the Trevor Project, which is really important for LGBTQIA+ community, they have their own as well, which is 678-678, and you can text START. And so I think those are really great resources as well. Like you're saying, right, those nerves of like making that call, sometimes texting can feel a lot easier. And then in terms of other programs, I know the Epilepsy Foundation has a lot of amazing programs. I think they lump them under a header called Epilepsy Well programs, and they have a lot of support groups for the individual, the young adult experiencing epilepsy, also for family or friends. They also have a really great helpline where you can call, again, let's say like with depression or anxiety, like it just feels like it's hard to make that first step. They can really help connect you to resources and help do some of that legwork initially. So I think support groups, honestly, are really, really wonderful. Like I really lean into that. And I know they can be really tough in terms of like feeling that anxiety of like, I'm supposed to be in a like room, whether it's virtual or not, with other people and talk about my challenges. But I do think that there's just such a benefit to hearing somebody like me say, I experienced similar medical challenges. I experienced similar emotional challenges. This is what's helped me to get through, or just to reduce that feeling of isolation.
Yeah. Honestly, either of you, do you guys have just other sort of tips on managing your mental health outside of therapies?
Definitely being outside or exercise, anything that just naturally releases like dopamine or endorphins. I know everyone says that, but it definitely like, and it seems silly, but it definitely helps, like going on a walk. I love listening to music, and even though my music is super depressing, so it seems like counterintuitive, like it sometimes does help to just like sit and then that like depressing music, like it can be like healing. Even going on a walk alone, like you don't have to go on a walk with a friend. If you just go on a walk alone, and like have your music in. That can be nice. I a lot of times will just like ask my dad like, hey, can you like we go on a drive? I mean, I can't drive myself, but it can be nice to just like, you know, have the windows down or just go somewhere new and just like just like little things to get out of the house, because a lot of us I know can feel, especially those who can't drive, can feel very stuck where we are, and like you just see the same things every day and you're just going through like, you know, see the same walls every day and you're just like, okay, I'm living the same day every single day. So just things that can get you out of the house, I feel like can really just boost your day a lot and then boost your mental health a lot.
Yeah, I think that's a really great strategy. Taking walks was something that happened during COVID when there was like nowhere else to go. And then I like realized, okay, this is like really lovely to take a walk, to breathe in fresh air. So I love that suggestion, Mia. And then also I think what I think about a lot, right, with this like mind body connection is our emotions, yes, will benefit from things that will help, that we can understand directly support in helping us feel less nervous or happier, but also things like sleep and eating and physical activity and hydration. You know, I always say like we think about stress, like emotional stress, but stress is also physical stress. And so I say it's like a car, like running on low gas, right? Like it struggles. I don't know if you've been in a car with somebody who's irresponsible like me and runs it down to low, but like, you know, it's tough. And so those things, those lifestyle factors are like our fuel, right? And so if we can focus on those pieces and make sure that we're fueled in that way, then we are better equipped to sort of get through challenging emotions. Like I even say like hangry is a real thing, right? Like there's a reason why we're hungry. We're less able to regulate our emotions. It might be like a little irritable, right? Because those things really impact, there is that mind body connection. So I think even to, you know, with seizures, it feels like so many things are uncontrollable. So many things are out of your control. So it's saying like, okay, what is in my control? Maybe what's in my control is what kind of sleep I get, how much time I spend outdoors, what I put into my body, the physical activity, just trying to find those little things that are in your control, right? To help you feel like, okay, I'm, you know, the leader of my life, as opposed to feeling like epilepsy is that leader and gets to determine everything in my life.
Some things that I'll just add, two things that have worked for me. Maybe if your epilepsy diagnosis doesn't allow it, but I like right when I wake up, I just get sunlight. I just like stand outside right away for the first 10 minutes. And then depending on if I have the energy for it, like cold plunging has really been helpful over the last couple of years for me, just to like shake my nervous system a little bit, because I'm like in my head a lot about my emotions. And so that can make me feel worse than it actually is, because I'm believing these thoughts and I'm following these irrational things that aren't necessarily true. But if I get into a cold plunge or even take a cold shower for 30 seconds, I just regulate my body and my mind a little bit more. And so that's been a good resource as well.
That's a good tip.
Mm-hmm.
Actually, Ben. Oh, no, go ahead.
A really good strategy, because like it actually, cold water, especially to the head, but like you can take it, you know, a shower or just a cold plunge, like it immediately elicits a relaxation response in the nervous system, right? So like sometimes I always say like to know why like strategies work, right? It helps me like believe in them a little bit more. It helps me feel a little bit more motivated to use them, but like it actually helps elicit that relaxation response. So I think that's such a good strategy to recommend.
Ben is a childhood cancer survivor and like has some experience with like dealing with, you know, major illness. And I'm curious, you were pretty young, I know, but did you ever have experience with like going to support groups or that being like an option, or how was that for you?
So yeah, I had cancer when I was 18, 20, and 22. So like that young adult.
Yeah, I guess you weren't childhood. I always say that.
But I'm 35 now. So it feels like I was much younger. So when I was going through it, I actually did not want to speak to anybody. I completely isolated because I didn't want to like accept my diagnosis. But what I did was about 10 years later, like I did start going to group therapy, and it actually changed my whole entire experience from my relationship to cancer. Hearing other people kind of talk about their experiences was helpful. I think it's super dependent upon where you are in your life, but I think at any point, at least talking to other people who have something that you've been through, whether it's in therapy or not in therapy, can just make you feel less alone. And I would just say that was like the hardest part then, and I think is still today, is feeling like no one understands your experience. But I think the more you speak about your experience, even though everyone's is unique, I think you will be able to draw some sense of like comfort by sharing it with other people.
This is why I wanted to ask you, because I do think, like, I love that Mia is able to share that, you know, how impactful group therapy was. But I also know I'm definitely like the kind of person that would be like, I don't know about a group. Like, sharing with people can be really scary. And it's cool to hear that you sort of had an evolution to eventually going back to that. And also these things, they do stay with you forever. And it's something you'll always be working through. And that's okay too.
For sure. I have a strong opinion on this, but I'm curious about Dr. Rizakos' opinion. And I think, Mia, your generation loves TikTok and thinks that therapy, like TikTok, therapists on TikTok are giving advice. And I think like a lot of people have opinions on that. And I'm not going to share mine, but maybe Dr. Rizakos, like, how do you feel about younger generation just scrolling on TikTok, seeing like top 3 things and then feeling like they're getting actual therapy there?
Mm-hmm. Yeah. So I don't have TikTok, right? So, but I do understand it and I've looked at it because obviously I have patients who are on TikTok. I think, right. Psychologists, I think, are so annoying for always saying like, it depends, right? But like there are pros and cons to everything. And I think that, whenever you really greatly increase the supply of really anything, the quality starts to become questionable, right? And that's in terms of really anything. So actually, I had someone just talk to me about this yesterday where they were saying like, I feel like, you know, I see these videos on TikTok and it's like, get ready with me. Like, this is my morning routine. This is how I like support my mood. And then it makes me feel bad about myself when I'm not doing those things, right? And I think there's a couple pieces to it. I say like use social media as much as it's able to serve you, right? As soon as you feel like it's negatively impacting your mood, causing you to judge yourself, causing you to compare, right? Which they say is like the thief of joy. Then like we need to start to put boundaries or limits on how much you're using it. I think my main recommendation is, if you're on TikTok or any type of social media and you're getting recommendations, know who's giving you the recommendations, right? Like, is this a mental health professional? What's their background? Are they licensed? Are they a psychologist? Are they a therapist? Who's their population that they primarily work with, right? So make sure the quality is there. And then also make sure that it's serving you, right? Is it causing you to feel every time you watch it, are you judging yourself for not doing those things? Then you need to shut it down, right? Then it's not helpful at this time. But I think definitely making sure that you look at the quality of the information you're receiving, which is tough because like, especially with TikTok, right? It's just like one thing after the other. And so I think that's the most important, certainly.
I agree 100%. And I also kind of I was thinking about this when we were talking about group therapy and Dr. Rizakos bringing up comparison being the thief of joy. I know when I started group therapy and also when I started talking to other people who had epilepsy, I would kind of catch myself comparing experiences and being sometimes spiraling. Like I remember I spoke to like my mom, like hooked me up with like a family friend and their daughter had epilepsy. And I was like, oh, cool. Like maybe we'll share experiences. And she's like, oh yeah, like I had my first seizure, got diagnosed in a couple months, tried this medication and now I'm seizure free. And I was like, okay, now I feel terrible because like it took me 10 years to get diagnosed. I've tried 1,000 medications and I have seizures every day and night. And like, it made me like I spiraled for days. Like I went down a whole spiral for days, like cried to my mom. I was like, I feel worse now. Like, I wish I never spoke to her. Like, this is so much worse. And then I like had to catch myself and remind myself like, okay, maybe just because her experience was like, quote unquote, easier, like there's still struggles that come with all types of epilepsy, all different experiences with epilepsy. Like, I don't like, just because maybe she can drive and she can do these things that I can't do, she's still dealing with things. And that doesn't mean there aren't people who are going through the same experience I'm going through with epilepsy. There's so many people with epilepsy. One experience that maybe is a little bit easier than mine doesn't mean like I'm going through the worst thing in the world. And there are people who are going through worse things than me. Like, I'm not in a hospital bed every single day. Like, I still get to live in my house. I still got to go to college. Like, my life feels like it was turned upside down, but at the end of the day, like I still get to do a lot of normal people things. And like I had to check myself and I was like, okay, like I'm spiraling because I feel like my life is so much worse than maybe these other people who are supposed to be similar to me. But like there are still things that I have to be grateful and thankful for because other people have it worse than me. And like sometimes in group therapy, I was like thinking those things. I was like, okay, these people have depression, but you know, maybe they're not suicidal or maybe they're not experiencing going through like self-harm or going through like losing all their friends or like all these, or they don't have a chronic illness or like all these different types of things. And I was like, but they're not sharing everything. I don't know their whole life story. I don't know their family situation. I don't like, you have to stop comparing. Like take it for what it is and use it as a tool to relate to people, to learn from them, to help them and like learn from each other, help each other, create a connection and don't try to like compare and make it like who's or like a competition, you know, nothing's a competition. You don't have to compare. It's not like whose experience is, you know, worse or better. Cause like you can catch yourself doing that when you start to like self-pity or like wallow when you get in those low points. Cause when you get in those low points of your life, like you can start to feel like self-pity and like wallow. And like, that's not a good spot to be in, especially when you're trying to form connections with people. And so like, you kind of like have to stop, like check yourself and be like, don't act like that. Don't be like that. No one wants to be around someone like that. You don't want to be like that. That's not good for you. And like move forward.
Well, I think that kind of goes back to what Ben was saying too, that a lot of it does depend on the place that you're in at that current moment. And if like you are in a place where you're going to be just being like, oh, but you don't have it as bad as me or whatever, maybe group therapy is not going to be right for you at that time. And those things can change and go in and out of. And I think that's what's, again, epilepsy and mental health are just incredibly individual. And so everything that we're saying may or may not apply to anyone who's listening. And it's just good to sort of know all these different kinds of experiences because things may change too over the course of your life. And maybe 5-10 years ago, you thought, I don't think I'll ever do group therapy. And then you want to try it and then you can. And there are things like that that are definitely worth acknowledging because that can also be one of the downsides to being in a community and sharing about your illness that feels so personal. Feels like it can feel like someone else is attacking you when they're just like sharing their experience, I think.
I know that my parents struggled a lot during my whole diagnosis phase, like especially because it lasted 10 years. And I know that's not the case with everyone, but I'm sure people can kind of see how maybe their epilepsy has affected their support system, particularly their parents or maybe their siblings or other family members. And it can make you feel sort of guilty. Like I felt like, you know, I'm the burden child, like all my other siblings, nothing's wrong with them. My parents don't have to do anything for them. And they have to do all these things for me. They have to drive me all over to go see doctors all over and spend all this money and all these tests when I would like sometimes see the bill for what a test would be. And I'd be like, oh my God, they're spending all this money on me. How can I ever repay them for like, and you have to like let go of this guilt and be like, this is what a parent is. They take care of their child. Like that's what they signed up to do. And I know, especially my mom, like she harbored a lot of guilt as well for like retrospectively thinking like, what could we have done more during that process of trying to get a diagnosis and being like, it took those 10 years and she's like, she still like tries to like grapple with it and feel kind of guilty that like, where did we go wrong? Like, what could she have done more? How could she have like shortened that process and made that easier and, you know, whatever. And, you know, I've tried to help her a lot, come to terms with it and be like, I'm not mad at you. It wasn't your fault. It was the doctors we went to not doing their job. None of all my anger and frustration and blame, none of it rests on you. And I know she's had a hard time, but like she's come to terms with it. And I think a lot of maybe like the guilt that goes around in support systems and the person with the illness, I think what helps is like actually expressing that the anger isn't with them. Because like, it seems like to me, it felt obvious that like, I'm not angry with her. I'm angry at the doctors. I'm angry at like the people involved. But she didn't know, like she kind of thought I was angry. She never knew. So like, it's helpful to just express that, be like, none of my frustration lies with you. I never blamed you. I'm angry at them. And then, you know, she expressed to me, like, I never felt like you were a burden. I never felt like, you know, you're the child that is like holding us back or dragging us down. Like, I've never felt that way about you. I see you as like strong and like you're doing things that make us so proud with how you're handling this. And so it's just like actually expressing it out loud instead of just assuming that they already know these things can be very healing and very helpful. especially like, because our relationship was rocky for a little bit because there was that disconnect, there's that miscommunication. So just don't assume that anyone knows how you're feeling. Just express it, and that can just be so healing for everybody.
I think that that's a great point. And I think to sort of add to that, I would encourage support systems to also look for therapy, because I think there is that fine line of you don't want to further the person who's dealing with the chronic illness. You don't also want to make them feel like a burden, but it's okay to have your feelings about it and to also acknowledge that you're going through your own struggles in that. I just think sometimes there's like a line between communicating that it's not about each other and then also not relying on that other person to sort of be the source of like solving your, I don't know. Like you don't want if it's your child who has this illness, you don't ever want them to be the one like comforting you in the sense of, I don't know, that's like a whole nother burden. So therapy all around.
Yeah, I agree. I appreciate you saying that, Sophie, because I think from a specifically parent perspective or caregiver perspective, right, you naturally want to give everything to your child and you want to try to put all your effort. You can't imagine not putting your child first, right? And what I try to say to parents, right, it's like what they tell you on an airplane, like you have to put your mask on first before you can help the person next to you. Like you're not best equipped to support and help your child if you're running on low, if you're not taking care of yourself also. So I try to take that like parental guilt off a little bit and saying like, if you are pulling in supports or formal supports like therapy for yourself, that actually is also going to help your child, right? Because you're not going to be accidentally having them have to support you with your challenges, because epilepsy, absolutely, it's going to impact the individual, but it also impacts the family and the caregivers as well. So I try to take off that guilt by saying like, if you care for yourself, right, it's also going to help your child.
Well, thank you all so much for being here. We really appreciate it so much. Thank you so much to Dr. Rizakos, Mia, and Ben for joining us today. I hope you guys got something from this episode. Thank you to our sponsors, UCB, as always, for making this happen. If you need it, the mental health crisis hotline is 988. And please go to thecameronboysfoundation.org for resources and our Facebook support group, Now What, to connect with other people who are going through what you are going through. Thanks for listening.